doctors, and welcome to today's program. The program topic today is Colossus. What is Colossus? Attorneys, doctors, anybody in the injury market itself is running into Colossus. So first of all, let's define what Colossus is. Colossus is basically a blanket term for evaluation software that the insurance industry uses in order to evaluate benefits and to evaluate the severity and significance of the injuries and how benefits are determined for a patient. So Colossus is exactly what an insurance adjuster uses to determine the benefits at the end of care. And it's also used in conjunction with other softwares to determine what should be paid on claims for injuries. So Colossus is really, really simple. It's been made far too complicated. There are some experts in the market that say, oh, you shouldn't know anything about Colossus. This is all, just a bunch of garbage. And then there's other providers that say, oh my God, you got to be so significant, so significant, so significant with Colossus. Colossus is a very logical software. And here's what I mean by that. I want you to imagine today that the United States decided that, I'm going to use a doctor, I'm going to assume that you're a doctor that's listening to this, that all doctors can no longer get any kind of business insurance for injuries. So if a patient falls on your property, let's say they fall out in front of your office in the soft grass, and they injure themselves, you are 100% responsible for those injuries. So lo and behold, you look outside and a person actually falls. And you hustle outside, it looks like they fell in the soft grass and it looks like there's no problem at all. They get up and there is no problem. Now, 8 months later, they come back and they say, look, doctor, I'd like $96,000. And you say, for what? For the injuries I sustained the day I fell on your lawn. And you're looking and you're thinking to yourself, well, wait a second. Now, this is how Colossus works and thinks. The first question you're going to have is the first question all insurance softwares have. What was the injury? What are the injuries? And that's called diagnosis. Those are also called ICD-9 or ICD-10 codes. They're called injury codes. So you code the injury. So first thing you'd want to know is, well, what are the injuries? The second thing you'd want to know, and the second thing Colossus needs to know, is, are these injuries permanent? And if so, how did you determine if they were permanent? Today, we have things called permanent impairment guides. That's how permanent injuries are determined. Okay, now, so your first question is, what are the injuries? Your second question, it's $97,000 being requested. Your second is this some kind of a permanent injury? And if so, how did you substantiate it? What made it permanent? And what evidence, what objective evidence do you have first of the injury, and then that fact that there's consensus that it's a permanent injury, right? Now, the second and third, or the third and fourth thing you would have is $97,000 for these injuries. Is there something you can't do as a result of these injuries? That's called loss of enjoyment of life factors. When a person can no longer do something as a result of an injury in the insurance industry, it's called loss of enjoyment of life, or it's called a disability, which is a loss of enjoyment of life. Not to be confused by disability in the workspace, which disability in the workspace is the inability, or the injury itself has caused a reduction or the inability for the person to earn a living. That's technically the term disability. So we have this loss of enjoyment of life. Person can't do something as a result of these injuries. No, they don't have any of that. Well, they could have. Then are there things that you can do? The next logical question, are there things that you can do that cause you pain when you do them as a result of these injuries? And are you chronically in pain as a result of having to do these activities? Those are called duties under duress factors. So you'd want to know that. Now, if a person had a permanent injury and they had some sort of duties under duress or loss of enjoyment of life factor, then they may also need ongoing care. Those are called future medical expenses. So those are the questions that you'd want to know. One, to the doctor, what were the diagnosed injuries and what doctor did you go to get this diagnosis? Two, are they permanent and how did you establish their permanency? How have they affected your life and how has that been documented? And if you're saying you need future care needs, based on what? That's Colossus, doctors. That's exactly what Colossus needs. Now, there's other things, but that's the simplicity of it. There's 5 major things that all injury claims require. Diagnosis of the injuries, all the injuries diagnosed. You need to have permanency established if there's permanency. You need to have the factors of how it interferes with the person's life well documented. And if you have permanent injury and you have factors where their life has been altered, they may need ongoing care. And that's called future care needs. Now, it's a little more complicated than what I just explained, but if the doctors in the market would just get the 5 things that I just explained and routinely document that, then it would be a whole lot easier in the market. The attorneys would have a lot easier time adjudicating claims. Now, that's not to say that attorneys also, like doctors, don't understand those factors. Attorneys sometimes will not understand a permanent injury or how the permanent impairment guides. For example, one of the biggest things that they misunderstand is that there are guidelines for work comp in their state, and then there are guidelines for everything else. And just because a work comp guideline says, for example, in the state of Minnesota, that you use the 3rd edition of the impairment guides, does not mean that that's what's used when a person is in an auto injury or has a home-related injury or has a sports-related injury. So there's misunderstanding in the market, but the bottom line is everyone in the market should know how claims or how injuries are assessed. And I just gave you the very logical, the most logical that I could come up with way to explain Colossus. It's super, super simple. But you have to have these things documented. And that routinely is starting to be done in the US by what we call smart injury doctors. Smart injury doctors for back and neck injuries are trained in these factors, and they're not trained to make claims or make a person need benefits more. They're actually trained to reduce the patient's future benefit needs by getting extremely good results. Colossus is logical. Injury workups are logical. When you understand both, it's very easy to provide what everyone in the market needs. The patient needs accurate diagnosis and great treatment results. If there's any attorneys involved, like a plaintiff attorney, they need incredible and simple to understand documentation. If there's an insurance company involved, they need incredible and simple documentation. They need comprehensive but very simple and easy to understand documentation. When injury doctors in the market provide that, everyone in the market wins. There's the adversarial environment significantly reduces down, and that's what we're producing today with Smart Injury Doctors. So doctors, I hope this little short bit on Colossus, and by the way, there are experts out there that say that no doctor in the injury market needs to know anything about Colossus. Nothing could be further from the truth. Colossus is easy to understand, and it's easy to document with once you do understand it, because it's extremely logical. So again, doctors, I hope that this short bit on Colossus was helpful to you today. Continue to sign up, continue to check out our episodes on various topics. We'll have interviews, but I like to keep, when it's not an interview style, I like to keep these short and to the point, and so that you can take something away from what you heard today. Doctors, thank you very much for your time on this program today, and have a great day.